Thank you all very much for being here. I want to thank the ranking member, Senator Sessions of Alabama, for being here. And I see my colleague from Minnesota, Senator Franken, delighted that he is here. As we in Congress continue working on broad legislation to reform our broken healthcare system and ensure accessible, affordable health insurance for all Americans, we take advantage of this hearing today to examine a particularly cruel effect of our current system, the millions of Americans drowning in medical debt. As healthcare costs continue to increase, so do the numbers of people who go bankrupt paying essential medical bills for themselves or their loved ones. Harvard University researchers recently estimated that medical debts are a driving force in over 60% of personal bankruptcy filings. 3/4 of the medical debtors in that study were covered by medical insurance. They acted responsibly and thought they were covered, but were bankrupted by copays, deductibles, premiums, coverage limits, and uncovered expenses. Families who think they are protected may be only one accident, one injury, or one diagnosis away from family bankruptcy. Unfortunately, the bankruptcy code does not distinguish between debtors driven into bankruptcy by medical bills and those who become insolvent through poor planning or reckless spending. The Medical Bankruptcy Fairness Act would change that. If enacted, this bill would waive procedural hurdles for filers with high levels of medical debt. It would waive the means test and credit counseling requirements, which are unnecessary, time-consuming, costly, even humiliating, for debtors forced to file by medical misfortune. In addition, my bill would help make it easier for medical debtors to retain their homes in bankruptcy by providing an alternative homestead exemption of $250,000. The default homestead exemption is determined by state law and varies across the country. While debtors in my home state of Rhode Island already receive a relatively generous exemption, debtors in the ranking member's home state of Alabama get to preserve only $5,000 of home value through the bankruptcy process. The Medical Bankruptcy Fairness Act would give medical debtors across the country a fighting chance to save their homes. Finally, too many debtors find themselves unable to file cases for a discharge of their debts in a Chapter 7 bankruptcy. My bill would make pre-petition attorney's fees non-dischargeable in bankruptcy. This will give debtors the option of paying their attorney's fees when they are on firmer budgetary ground after completing the bankruptcy, in turn making less expensive Chapter 7 proceedings more viable. I look forward to hearing the views of today's panel on this proposal and others. Burns, a constituent of mine from Coventry, Rhode Island, will share the story of the loss of her young son, Finnegan, to cystic fibrosis. Even though she had health insurance, the costs of her son's illness ultimately forced her to walk away from her mortgage and declare bankruptcy. She is accompanied here at the hearing today by her husband, Patrick. Elizabeth Edwards works on healthcare issues as a senior fellow at the Center for American Progress in Washington, D.C. Mrs. Edwards has long advocated for healthcare reform, both as an attorney and on the campaign trail with her husband. Mrs. Edwards holds a JD from the University of North Carolina and has had a distinguished career as an attorney working for the North Carolina Attorney General and in private practice. We welcome her. Professor John Potto is tenured professor at the University of Michigan Law School, where he specializes in bankruptcy and commercial law. Following law school at Harvard, Professor Potto clerked for the Honorable Guido Calabresi on the Second Circuit Court of Appeals and the Right Honorable Beverly McClatchin on the Supreme Court of Canada. His extensive scholarship includes work on bankruptcy reform and consumer lending. Aparna Mathur is a research fellow at the American Enterprise Institute, where she has done work on tax and economic policy. Dr. Mathur holds a PhD from the University of Maryland, where she served both as teaching assistant and instructor in economics. She has also worked as a consultant to the World Bank. Our final witness, Diana Furchtgott-Roth, is the director of the Center for Employment at the Hudson Institute, a think tank in Washington. Prior to joining Hudson, Mrs. Furchtgott-Roth was chief economist of the U.S. Department of Labor. From 2001-2002, she served as chief of staff at the President's Council of Economic Advisors. She received her bachelor's degree from Swarthmore College and holds a master's degree in economics from Oxford University. I welcome the witnesses, and I call on the ranking member for his opening statement.